Today we're going to talk about artificial nails. I'm going to inform you on how and why bacteria grows and what types of artificial nails there are, and is there a risk for nurses wearing them with direct care patient. Acrylic nails, safe or not safe? Depends who you talk to. I'm going to tell you the safe part of it and how to be safe, and then how you can be the other way and what happens when you are not safe. We're going to show a slideshow here. Acrylic nails, safe or not safe? Safe. Fortunately, it is very uncommon for people to have significant health problems if the nails are properly sterilized when they're put on, or if you take proper care of them as the person wearing them. So overall, it's pretty uncommon for acrylic nails to have any huge potential health risk. Nurses risking their patients. Let's see, it's not cooperating. The 2002 Centers for Disease Control and Prevention published a guideline for hand hygiene in healthcare settings. I just wanted to give you a little bit of information that came from them. They recommended that healthcare workers not wear artificial nails, especially if they're a direct care patient givers. However, they gave some guidelines of why and what you can do to help prevent that. The reason they say that artificial nails should not be worn as a direct patient caregiver is bacteria is a higher growth on the people that have the artificial nails. It gets underneath the nails, it gets underneath the glue. There's just different things that promote it. It peels back the cuticles of your nails, which in turn lets bacteria grow there. It's a warm, moist area that can be trapped under there. There's no air that gets to those nails, which would help eliminate and kill the bacteria. That air cannot get there. It's just trapped, warm, moist air. If you're not going to wear artificial nails but decide to wear fingernail polish, they also have some recommendations on this. Chipped nail polish supports organisms to grow. So they say clear polish is the best, and immediately if you have chipped polish, or if your nail breaks, go file it off. Make sure you get your fingernail polish off. Make sure you're doing your hand scrubs and hand cleanses. Even after crucial hand washing with the people that had artificial nails on, there was a substantial amount of bacteria still that remained on those nails. It's just an awesome place for those bacteria to hide out. It's hard to get underneath those nails. Your natural nail lifts underneath those nails. If you do have artificial nails, highly, highly, highly recommended that you only wear them for 3 months, and then they can be off for 1 month. You need to let your natural nail get back some stability. You need to let that nail be open to air and not close it back off again. The glue that they use supports bacteria growth. I'm just going to show you a picture of nail care fungus that grows on the nails. The nail becomes white and thick and can be very painful, and it takes months and months to get treatment that will help this, and it can go systemic, which means it can go throughout your whole body. A fingernail fungus that has infiltrated the nail is referred to as onychomycosis. It's an invasive invasion of an organism, and it's due to artificial nails and water. The moisture stays under those nails. It's trapped. The air can't get to it again. Air pockets. If there's an air pocket when your nails get put on, the gap becomes a breeding ground for fungus. A couple complications that are promoted by nail fungus. Extreme pain and discomfort. The fungus can spread to the skin that surrounds the fingernail, including the cuticle and the rest of your finger. It can also result in a condition called cellulitis, which is an infection of the skin. Treatment for artificial nail fungus is immediate removal of the fingernail. Most cases are treated with a topical anti-infective agent, but it takes a long time, months and months. They say the minimum is 6 months, and these treatments can be very expensive. An antifungal nail polish or nail lacquer will also be another option for treatment for nail fungus. And the fungus grows well because if it's damp, airless place, like inside shoes on warm, sweaty feet. These false nails restrict the flow of air around the nail. Fungal infections of the fingernails are much less common than toenail infections, but keep in mind that a natural fingernail covered with a sheet of acrylic, fiberglass, or other synthetic material does not get much of air exposure. Those are some of the types that they use when you go to a shop and they do the artificial nail. They'll use fiberglass, they'll use acrylic. Jayco, I just wanted to go over some recommendations that they have for you. They're saying avoid artificial nails at all costs. It's just too risky for you, for the patient. If you have natural nails, they need to be 1/4 of an inch or shorter. Polish should not be chipped at all, and do not wear the polish for more than 4 days. And then you need to remove that polish, let your nails breathe for 4 hours, and then you can reapply a different type of polish, different color. So I just wanted you guys to all be aware of the different things that happen, the different types of infections that can happen. It's not just a fungus that happens and you get rid of it the next day. I want you to be aware of how the treatment is expensive, the treatment takes time, and it's very embarrassing. And the fungus of the nail, like I showed you in the picture, it's not a very pretty sight.